Good afternoon, and a very warm welcome to everyone joining us today with our special guest, live from Stanford, Professor Jeffrey Pfeffer. My name is Kyle Rhodes. I'm a professor of organization studies, and I'm the dean here at UTS Business School. Before we begin the proceedings, and on behalf of everyone here, I would like to acknowledge the Gadigal people of the Eora Nation, on whose unceded ancestral lands the UTS City campus now stands. I'm here at my office on that very campus. The Gadigal people have cared for their community, their land and waters for thousands of generations, and have done so based on a deep knowledge of the country. I'd like to pay respect to their ancestors, their elders, and acknowledge their ongoing status as the first peoples of this land. Now, before I introduce our special guest, just a few housekeeping items. Today's webinar is being recorded and will be made available as a download very soon via the UTS YouTube channel. We'll share the link by email to each of you and via the various UTS social media channels sometime next week. To minimize any technical interruptions and distractions, we've deactivated your cameras and your microphones. But I do encourage you to submit questions or comments in the Q&A box in your Zoom control panel. We're going to try to get to as many questions as possible, and thank you to those people who submitted questions at the time that they registered. And now, let me introduce to you our very special guest, Professor Jeffrey Pfeffer. Jeffrey is a Thomas D.D. II Professor of Organizational Behavior at the Graduate School of Business at Stanford University. He's taught there since 1979. His current research focuses on the effects of work environments on human health and well-being, power and leadership in organizations, evidence-based management, the knowing-doing gap, and how thinking of time like money affects people's choices about spending time in ways that promote unhappiness. Professor Pfeffer received his bachelor and master's degrees from Carnegie Mellon University and his PhD from Stanford before an extensive teaching career at the University of Illinois, the University of California in Berkeley, as well as Stanford. He has been a visiting professor at Harvard Business School, Singapore Management University, London Business School, Copenhagen Business School, and for the past 14 years, a visitor at IESE in Barcelona. He is in the Thinkers 50 Hall of Fame and has been listed as one of the most influential HR international thinkers by HR Magazine. He's written extensively for various publications, including Business 2.0, Fortune, BNet, The Washington Post, Bloomberg Businessweek, BBC's Capital, and he's ranked as an influencer on LinkedIn. He's the author and co-author of many hundreds of scholarly works and 15 books, and that includes his latest book, Dying for a Paycheck: How Modern Management Harms Employee Health and Company Performance and What We Can Do About It. That is the topic for today's presentation and discussion. It gives me great pleasure to welcome Professor Jeffrey Pfeffer.
Thank you. It's a pleasure to be with you all today, and I'm going to go through my presentation hopefully reasonably efficiently, and we'll have plenty of time for questions at the end, and with that we'll launch into it. Oops. Oh, there's something happening. We'll see. And for the larger society. Oops. So let's talk about the costs. I'm going to begin with the costs ranking above the things that we mostly talk about, which are physical inactivity and obesity. Chronic disease, less than a small fraction of the US has no chronic disease, and actually 39% have 3 or more. And it will not surprise you to know that the more chronic diseases you have, the higher the healthcare costs. 90% of the US's healthcare enormous expenditures are for people with chronic disease and mental health conditions, which of course is true, I think, again, around the world. The study I did with 2 colleagues at Stanford shows that the workplace is the 5th leading cause of death in the United States, responsible for 120,000 excess deaths per year, which ranks it ahead of kidney disease and Alzheimer's. The American Institute of Stress says that job stress carries a price tag for US industry estimated at over $300 billion annually. And this is not, again, a problem just in the US. Vitality United Kingdom, which does Britain's healthiest workplace study, found that severe depression had doubled, and that the days of productivity lost per employee from absenteeism and presenteeism had increased by 65% in just a relatively few years. So depression has doubled, absenteeism and presenteeism and the loss of productivity from that has gone up 65% in a relatively short period of time in the United Kingdom. Meta-analyses show, that's taking studies and combining the results, that many workplace conditions are as harmful to health as secondhand smoke, a known and regulated carcinogen. Mental Health America has found in a survey that more than 7 of 10 employees admitted that they badmouth their employer outside of work. 3/4 of all employees are either actively seeking a new job or thinking about doing so, and these data were collected prior to what is now being called the Great Resignation, which is, of course, what has happened as a result of COVID, at least in the US, where many, many, many millions of people are leaving their job because they have figured out that their jobs are not suiting them, either in terms of their behavioral health or in terms of their physical health. So let's talk about the costs in Australia. The State of Workplace Mental Health in Australia study said that 90% of employees think that mental health is an important issue for businesses, but only 50% believe that their workplace is mentally healthy. 20% of Australian workers say that they are currently experiencing a mental health condition. The Australian Bureau of Statistics reports that although anxiety and depression can be as debilitating as a serious physical illness, less than half of the people experiencing these conditions seek help. And that, again, is data that is typical from around the world. Only a small fraction of people facing anxiety and depression seek help. And of course, if you don't seek help, the odds of getting help are very low, and therefore the odds of anxiety and depression persisting are very high, and these are debilitating and costly conditions. Instinct and Reason, a study done in Australia, 3/4 of Australian employees say a mentally healthy workplace is important when looking for a job. The World Health Organization estimates 850,000 deaths worldwide and 24 million years of healthy life lost from occupational hazards, including stress. In China, an article estimated that 1 million people per year are dying from overwork. The World Economic Forum, which has paid attention to this issue, particularly in the last several years, notes in their report that a lack of wellness in the labor force costs the global economy 10 to 15% of GDP. In the US alone. Work-related injuries, illnesses, and stress cost the economy $2.2 trillion a year. OSHA estimates 2 million people per year are victims of workplace violence. That's our Occupational Safety and Health Administration, and the toll is underreported. So the first reason why we ought to pay attention to behavioral and physical health is that the costs are enormous. By the way, many people do not take, including many employers, including many employer health plans, do not take behavioral health seriously, but stress and depression affect physical health. Health runs to the brain. And stress and depression affect health in 2 ways. The first way is that it has been well known for literally decades that stress and depression affect individual health relevant behaviors such as smoking, drinking, illicit drug use, not getting enough exercise, overeating, and absence of sleep. Stress and depression also affect blood markers, which indicate an inflammatory response. And stress and depression affect the central nervous system's regulation of the endocrine hormone system, which of course affects health. A study that I did with some colleagues found that that depression was associated with a 59% higher risk of cardiovascular disease, a 30% higher risk of diabetes, a higher risk of cancer, a 306% increase in sedative use, and a 411% increase in the use of amphetamines. And we did this by looking at people who took antidepressants as a marker for depression, and then we looked prospectively and longitudinally at when they started taking drugs for cardiovascular disease, diabetes, cancer, and sedatives and amphetamines. So this is a causal study. And by the way, the mechanisms, which are on the left-hand side of this slide, show the physiological ways in which stress and depression affect health. As I've already said, studies show that overeating, alcohol consumption, drug use, the absence of exercising, and smoking are all related to stress. The psychiatrist Richard Friedman, who writes occasionally for the New York Times, said no one will be shocked to learn that stress makes people more likely to search for solace in drugs or food. It's called comfort food for a reason. Now we have actually an extensive body of research that makes the connection between stress and addiction definitive. And notice that I am emphasizing, and as I will emphasize throughout this talk, not individual choice or individual psychopathology or individual genetics, but I am emphasizing, as social psychology has for 70 or 80 years, the effect of environment on behavior. We are subject to and affected by the environments in which we work, including, of course, our work environments. So our work environments affect how we eat, how we sleep, or if we do. It affects, obviously, our use of drugs and alcohol as ways of essentially trying to deal with the pain inflicted upon us by abusive bosses and other adverse job conditions. So just as if you broke your arm or leg or scratched yourself or had a cut, you would attempt to both treat the disease, but you would also try to probably numb the pain. That is exactly also true for psychological pain as well. And so therefore, it behooves organizations to try to reduce the psychological pain experienced by their workforce. Now, for some reason, it has decided to stop advancing. There we go. So why should employers care about this? Because behavioral and physical health have been in numerous studies that, again, many go back many years, related to absenteeism, missed work days, presenteeism, being at work but not being able to concentrate and being fully productive, turnover. Turns out that if you're sicker, you're more likely to quit the job that is making you sick. Employee engagement, it's been reliably related to engagement, which everybody is concerned about. It is obviously related to healthcare costs, both for the employer and for the society largely. And it also is related to governance and employer's brand and reputation. So employers should care because sickness is not just something that is borne by the society and the employee. The costs of sickness are borne by employers as well. And by the way, here's another reason why employers should care. According to an article in the New York Times, the former chief executive of one of France's biggest telecom companies and two subordinates were convicted on Friday of institutional moral harassment and the suicides of 35 employees in the mid-2000s and were sentenced to jail. There is, in fact, potentially, in many countries around the world, legal liability both in terms of liability costs and in terms of actually being sentenced to jail for the ill health of your employees. It's only happened so far in France, but it could happen elsewhere as well. So we've talked about why employers should care and society should care about employee health and well-being, both behavioral and physical. Behavioral health is connected to physical health, and the costs of ill health are enormous along multiple dimensions. The next thing I want to spend on is how. The next thing I want to spend time on is to discuss how. If you are convinced that workplaces should get healthier, how do you do this? And I would argue that the first thing you need to do is stop doing harm, understand the primary sources of workplace stress at work, and then work to eliminate or reduce them. And it turns out that most of the things that cause stress and depression at work, employers could eliminate easily because they are not benefiting the employers either, even though employers tend to think that they do, but they don't. So what affects health? Interesting. Let's see. Who knows what seems to have happened? Doesn't seem to want to advance. Well, I have no idea why. Ah, there we go. We unfortunately went too far. We went much too far. This is like odd. Well, let me see if I stop this and reshare if this will get us back on track. Okay. I'm back, I think. There we go. Oops. My host has stopped my video. Can you hear me?
I'll bring that up now, Jeffrey.
Yeah. My Zoom crashed. God knows why. It could be worse. We could have had trouble with Comcast, but it is not. It says I cannot start my video. So can you see my screen?
Yes.
Okay. Good. Here we go. Okay. So what affects health? Offering health insurance, which is only an issue in the US, job design and job control, overwork and high work demands, resulting in job strain. Work hours, which we'll talk about, providing social support and conditions that facilitate its development, reduces stress, practices and policies that affect work-family conflict, perceived fairness and justice, layoffs, and economic insecurity. So if you fix these things, you actually increase health. So work hours and shift work affect health. A study in California found a positive association between hours worked and hypertension. Results from a prospective observational study suggest an approximately 40% excess risk of coronary heart disease in employees working long hours. And the National Institute for Occupational Safety and Health reported that in 16 of 22 studies, overtime was associated with poorer health, increased injury rates, more illnesses, and increased mortality. And by the way, the studies have been done around the world. It is not just in the US that long hours affect health, and the mechanisms through which long hours affect health, of course, have been uncovered. Many of you, I'm sure, have read books about the connection between sleep and health. You cannot sleep if you're working, mostly. Many of you have read studies connecting sleep to the operation of your immune system. It's the same thing. So sleep is one mechanism through which work hours affects health. Work hours also affect health because in many organizations in this famous Silicon Valley, the way they deal with people who they want to work long hours is they serve them salads at lunch, but at 5 p.m. all the fats and sugar come out, because if you're going to keep going, it turns out fats and sugar are very useful for you. Social support affects health. Social support means group and team memberships and social ties and explicit emotional, often accompanied by financial support. And it turns out that if you, in fact, support people, as DaVita, the dialysis company, does, as JetBlue and Southwest Airlines does, through funds to help employees, as the Men's Warehouse used to do by financially assisting employees facing short-term cash issues, you demonstrate to employees that your employer and coworkers care about people's well-being, which helps their mental and physical health. If you give opportunity for social events and volunteering, it brings people together, which creates social bonding, and teamwork builds cohesiveness and reduces a sense of social isolation. So social support affects health. Work-family conflict obviously affects health. It affects, in longitudinal studies, mood, anxiety, and substance dependence. It affects absence from work. It affects depression, poor health, and alcohol use. And you can read the stuff on the screen. This is very, very important. The work-family conflict affects people's health. It is not just an inconvenience. It is not just a it's not just a stressor. It affects their physical and behavioral health, because obviously stress affects people's ability to cope with the world. Perceived fairness and justice affect health. The mechanism and perceived justice, what does that mean? It means workplace bullying, as described by my colleague Bob Sutton in his famous book, The No Asshole Rule. It includes sex harassment. It includes racial discrimination. And the mechanism is that perceived injustice, because of some procedural or outcome unfairness, creates emotional reactions or stress. If you are harassed, if you are bullied, if you are discriminated against, you are going to be stressed because you're going to have a sense of injustice and unfairness. And for most people, that will arouse your emotional, your endocrine system. It will increase your cortisol level, which is a stress hormone. A longitudinal study in Finland found that low justice in decision-making was associated with a 41% higher risk of sickness absence, 12% higher for women, and a 40% higher risk of self-reported poor health for both genders. And a review of the evidence concluded that low justice has been shown to increase the risk of mental distress, psychiatric disorder, sickness absence, and poor self-rated health status. And if you've noticed, by the way, many of the effects we're talking about are huge, 50%, 60%, 40% increases in poor health. Layoffs and economic insecurity affect health. Using longitudinal data, a demographer called Strully found 54% Job loss from establishment closure increased the odds of reporting poor health by 54%. If respondents were healthy at baseline, losing a job from closing an establishment increased the odds of a new health condition by 83%. 80%, if being fired or laid off, increased the odds of reporting fair or poor health by 80%. And even respondents who found a new job had a 97% higher risk of developing a new health condition if they had been laid off. The age-adjusted odds of committing suicide were about 2.5 times higher for unemployed compared to employed New Zealanders. The overall mortality risk increased 44% during the first 4 years following job loss. There was a twofold increase in suicides and alcohol-related mortality. Job design and job control affects health. Employees with high job strain or employees who have high work demands coupled with limited job control, otherwise known as autonomy, had a more than twofold increase in cardiovascular mortality risk. And years ago, Sir Michael Marmot, a famous British epidemiologist, studied British civil servants in the famous Whitehall studies. He found that men in the lowest job ranks had 1.5 times the risk of developing heart disease compared to men in the highest grade. Differences in the psychosocial work environment explain the difference. So the first thing you want to do, if you go back to the first slide in this section, which talks about, first do no harm, you want to stop work-family conflict. You want to stop layoffs, which, believe it or not, you can do. You want to stop or severely reduce the absence of job control. You want to stop putting people in situations. You want to provide people with more social support. You want to stop putting people in situations that we know for literally decades of research contribute to ill health, both physical and mental. You want, in short, to create a culture of health. So we began by talking about why you should do this, which is the enormous cost for both employers and society. We then talked about the various factors that many studies, literally hundreds of studies, have shown are related to ill health, increased mortality, and increased morbidity. I will end this formal part of my talk by talking about how to create a culture of health in your organization. And basically it means creating, number one, a culture of wellness. You have organizational values and actions that promote personal and professional growth, self-care, and compassion for ourselves and our colleagues. Many companies are doing this. They are putting in mental health wellness apps. They're putting in exercise programs. They're putting in smoking cessation programs. They are putting in things that help people engage in better self-care. And that is obviously important, but it is insufficient because it does not affect, of course, the environment. So then you also want to work on efficiency of practice, the workplace systems, processes, and practices that promote safety, quality, effectiveness, positive interactions, and work-life balance. And you also want to, of course, to work on helping people develop personal resilience. So let's get specific about this. First, measurement. Some years ago, companies, for the most part, did not care about customers. Believe it or not, airlines were notorious for this. And then they decided, based upon Fred Reichhold's famous book, The Loyalty Effect, that customer retention was important. So what did they do when they wanted to increase customer satisfaction, customer retention? The first thing they did, of course, was to measure it. The ubiquitous would you recommend, the famous Net Promoter Score. And the reason why measurement is so fundamental is you cannot manage anything if you do not measure it. So you can measure behavioral mental well-being, stress and depression. You can measure prescription drug use. You can measure how many drugs your employees are taking, particularly ADHD drugs, which keep them awake, particularly sleeping pills, which tells you that they have sleep disorders, and or antidepressants. You can measure the dimensions of work environments that affect health, all the things that I have already talked about. Work hours, of course, are simple to measure. You can just measure how many hours people are working, but everything I have talked about before, including job control, including work-family conflict, have validated scales to measure it. And here's the best news of all. A single item measure of self-reported health. How healthy are you on a scale? Sometimes it's 1 to 5, sometimes it's 1 to 9, sometimes it's 1 to 7. Single item measure of self-reported health has been found to reliably and prospectively predict people's subsequent use of physicians and their subsequent mortality. So this is not hard to measure. The reason why we're not measuring it is, in the words of a famous HR person whose name I won't use, but most employers frankly don't care. But if you cared, you could measure every dimension of behavioral and mental well-being, drug use, dimensions of work environments, and you could do something about this. Both SAS, the famous software company, and DaVita, the kidney dialysis company, are examples of organizations that measure extensively physical and mental well-being. SAS has a chief health officer, not a chief medical officer, not a doctor, a nurse, who is responsible for keeping the employees at SAS healthy, both behaviorally and physically, because SAS understands everything that I've been saying, that health is related to productivity and turnover. Next, once you've measured it, make this a priority. When people come to work, they entrust their psychological and physical well-being to their employer. Become a good steward of the lives entrusted to you. Just as companies now are trying to become better stewards of the physical environment, they should try to become better stewards of the carbon life forms that come to their workplace every day, which are called human beings. Gallup, the polling organization, SAS Institute, Barry Waymiller, manufacturing conglomerate, all have a priority on the health of the workplace. And that is because they understand the connection between physical and mental well-being and company performance. Give people more autonomy. For 50 years, maybe more, in the field of organizational behavior, we have known that job autonomy is positively related to motivation, that job autonomy is positively related to employee engagement. How do you force people to give their employees more control over their work, more autonomy in their work? When I interviewed the head of HR for Patagonia, the famous clothing company, he said, what we do is give people so many people to manage that they cannot possibly over-control them. We call this management by absence, which oftentimes works quite well. Next, give people job security. Let people know their schedules in advance and avoid layoffs. Southwest Airlines has never had, to this day, a layoff or furlough. Lincoln Electric, the arc welding manufacturer, does not lay employees off. Barry Waymiller, a manufacturing conglomerate, which lost a lot of its business during 2008 in the financial crisis, which had, of course, all of the issues associated with the pandemic, laid off no one. One Medical, a primary care, an operator of primary care clinics in the United States, laid off no one during the initial months of the pandemic, even though, of course, demand for primary care went down, is because people were afraid to leave their homes. They, by the way, also cut no one's salary. It should not surprise you to know that, at least in the United States, where finding a nurse to work in a healthcare system, it requires almost a miracle. One Medical has had low turnover and has no trouble hiring people to work for them. Provide people social support. Let people work in teams, including self-managing teams. People are social creatures. We love to be in the company of other people. So have virtual teams or real teams. Have people work with their teammates. You will let down your boss, but you will never let down your teammates. Give people opportunities to volunteer their time with their coworkers. This is very important. It turns out that there have been many studies that shows when you volunteer your time with your coworkers, your love of your company goes up and you feel more bonded with those coworkers who can provide you social support, and social support both buffers the effects of stress and directly reduces stress. Provide people financial and psychological support for people having difficulties. Examples would be Southwest and DaVita. DaVita has what they call the DaVita Village Network, where when people are having difficulties, they get contributions from their coworkers, which are pooled, and then the company matches those contributions. Southwest does the same thing. And by the way, there is not only the direct effect of showing, support and helping people, when they have physical or psychological challenges such as cancer, but it really is very comforting to people to know that their coworkers and their employers care about their well-being. And sometimes just demonstrating that care is sufficient to help people. Control work hours. Have and enforce limits on contacting people off hours. This is now the 4-day work week and letting people work fewer hours. Now there are books about this. It turns out that working hours does not equal job performance. You want to manage people's working time. At SAS Institute, they've always had, for as long as I've known them, a 35-hour work week. And what their CEO, Jim Goodnight, will tell you is that, and by the way, he leaves at 5 o'clock also, what he will tell you is that if you eliminate wasted meetings and wasted time, he said to me one day, he said, people don't actually work 35 hours a week on productive things. They work 35 hours a week oftentimes on unproductive things, which gets me to my last and final and probably most important point. Redesign jobs to reduce stress. Many of our jobs have never been, leaned or, redesigned as Toyota would redesign other work processes. Involve employees. One of the things that my friends at One Medical did is when they took over, when Amir Dan Rubin took over the company as CEO a couple of years ago, he said, we are not going to have people use software that doesn't suit them. We are going to hire 100 software engineers and build customized technology, which includes software, to help people do their work. So don't take necessarily off-the-shelf things, build customized technology. By the way, that is what DaVita did also. When I wrote the case on DaVita, they had their chief technology officer, as every senior executive did, work in a dialysis center for a week. And after working in a dialysis center for a week, he understood how to build software that would help people to do their jobs more efficiently, and eliminate all activities that do not add value, which involves basically process redesign and lean thinking. Just as you would do this on a manufacturing line, where you would take out the processes that are not adding value, you would do a process mapping. You can do this for every job in your organization, which is precisely what One Medical is doing now to try to reduce physician burnout, which is a huge problem, at least in the United States, and I believe worldwide. And one of the reasons why there's so much physician burnout is physicians are working long hours. And one of the reasons why physicians are working long hours is because their jobs have not been optimized. I spent Thanksgiving, the American holiday dinner, sitting next to someone who worked in an emergency room. He was a doctor, a resident, a fourth-year resident in one of the New York City emergency rooms, where he had to push the patient's beds from one place to another, where he had to change the beds in some cases. This is not optimizing the use of scarce and very talented, human capital. So that is that. I've told you 3 things. Why? Whoops. Still can't start my video because it's under control of somebody else other than me. But in any event, so I've told you, number 1, the costs of ill health. I've told you some of the sources of ill behavior and physical health. And finally, I've told you how you can, and a set of relatively straightforward and implementable steps, build a culture of health and get rid of the things that are causing difficulties. And so with that, I finished 5 minutes early in spite of the fact that we had a Zoom crash, because you never can tell what's going to happen with software, because the software has not been optimized either. But in any event, I will now open this up for questions.
Look, thank you very much, Jeffrey. That was a very stimulating discussion, if not troubling in many ways, but at the same time, you know, the solutions you provide, as you say, being very, very practical and actionable. We do have a number of questions that people have typed in the Q&A, as well as some before. We can still take questions if people are typing, but I'll start with the first one. This is from, the question is, duty of care is a key risk management concept, and in some countries, a legal requirement. So in relation to the workplace, to what extent do employers understand their obligations when it comes to employees' physical and mental health? I mean, you pointed to some good examples, but could you talk more generally on whether you think employers get this?
For the most part, I think if there's one positive thing that has come out of the pandemic, and the famous Great Resignation in the US, is I think employers are getting it. I don't think they generally get it. And if you look at the parallel with the environmental movement, 30, 40, 50, now maybe 60 years ago, we permitted organizations to externalize the costs of polluting the air, the water, and the ground. And therefore, when they don't face the cost, they overproduce pollution. And many employers 50, 60 years ago, many companies 50, 60 years ago, were very poor stewards of the physical environment. And then people said, this is not good, and now there's a race to try to be more environmentally friendly and talk to people about how much recycling you're doing and what your environmental impact is, and so on and so forth. I believe we need to go through the same transition with respect to the human environment. In the words of my friend Nuria Chinchilla, professor at ESA, why do we care more about polar bears than human beings? Which is an interesting question to think about. I believe that employers, for the most part, don't care about their employees' well-being. And the evidence that they don't care about their employees' well-being is that if they did, they would measure it. To go back to the talk, and to go back what I think you have to do, when companies began to care about customer retention and customer satisfaction, they began by measuring it. And then said, we're going to have a program to improve our customer retention, to improve our net promoter scores. And we're going to try different things. But if you don't measure it, you'll never know what works and what doesn't work. And I think the best indicator of how little employers care about their employees' well-being is how little they measure.
Excellent. Thank you very much for that. Well, let's turn to another question. This person points to a recent expose by the Australian newspaper about bullying and abusive behavior by the alleged behavior by a CEO, which, there were talks of intimidation. Employees felt unsafe. People were sent to hospital as a result of how they behaved. And then at one point, employees actually had to sign non-disclosure agreements so they couldn't talk about the situation as they left. I mean, much of your talk was about what employers can do, but if you're an employee caught in a tremendously unhealthy environment that can even send you to hospital, what advice would you give to employees in terms of their own looking after their own health?
Well, that's a fabulous question, which I get asked quite regularly. And what I tell them is, if you're in a room full of smoke, if you're in a room that was filling up with smoke, what would you do? You would leave the room. And therefore, I would tell them that you need to leave. And I hear these people, say, well, I'm only going to do it for a while, and I'm only going to do it until my options vest, or I'm only going to do it until this, that, or the other thing. And there was an article in the New York Times which talked about the Palo Alto Medical Foundation, which sends clinics to these high-tech companies because the employees are working too hard to bother to go see their doctor. And so the clinics have to come to them. And the article quotes the head of the PAMF mobile medicine thing as saying, I've seen 30-year-old employees with 50-year-old bodies. If you're a 30-year-old employee with a 50-year-old body, your odds of being able to get your 30-year-old body back, regardless of what you do, is very low. We know from the quality movement, we know in a variety of domains, and health is certainly one of these domains, that prevention is a lot more effective and a lot less expensive than remediation. So when you believe your job is making you ill, you need to find a job that isn't making you ill. And I am still trying to find a district attorney in the United States that will do, which I think you could actually prosecute under the law, which is arrest some CEO who engages in bullying behavior for assault. Because, by the way, the assault that was just described by you and the person who asked the question, the workplace bullying and abuse is just as much an attack on someone's well-being and physical well-being as it would be if I punched you in the jaw, probably more.
That's good advice. I want to bring you to another thing now. At the beginning, and at one point, you talked about the Great Resignation, which, as you say, very recently has been getting press and also spreading from the US elsewhere in the world. And at the same time, this kind of problem of health in the workplace. Now, some businesses might see this as an opportunity, that if you can offer a workplace that promotes health, or at least doesn't harm your health, then this can assist in terms of attracting employees in what one time was called the war for talent and employer of choice. Do you think this is a real thing, or if anyone's actually seeing this as an opportunity in this respect?
I don't know if anybody's seeing it as an opportunity, but the premise of your question is certainly correct. Companies that are known as a great place to work, first of all, financially outperform the others. That's been demonstrated many times by the Great Place to Work Institute. Secondly, it is the case that with websites now like Glassdoor and some of these others, where employees are sharing their experiences, if you want to have an easier time hiring people, you need to offer them a workplace that promotes well-being, both physical and behavioral, as opposed to being a workplace that doesn't promote well-being. So this is certainly an opportunity for organizations, but you know, how many of them are taking advantage of the opportunity, who knows? But I can tell you, you know, I mean, One Medical was a company that in its 10 years of existence, this runs the primary care clinics in the US, had raised $180 million. Amir Rubin came in and basically began making changes in how, and he understands, I think, the basic premise of Fred Reichel's book, The Loyalty Effect. If you want loyal customers, you have to have loyal employees. It's anybody who's flown understands you can get on a plane and tell within seconds whether the staff is well treated or whether they want to kill the CEO and have just been prevented to because the CEO travels with guards. So, you know, employee customer retention comes from employee retention, and employee retention comes from organizations that basically obviously prioritize the well-being of their employees. So this is a huge opportunity, not only to make your employees better off and more productive and reduce turnover, but also through the Reichel logic to improve your customer experience and your customer retention as well.
Excellent, thank you. Now, and I'm going to combine two questions because they're kind of around similar issues, and this relates specifically to the issues you've been talking about in the, well, let's hope we'll soon be calling a post-COVID world. And one of this is saying, well, COVID has produced this discourse of so-called new ways of working, which is obviously about hybrid working, working from home, use of technologies, and so forth. And, you know, wondering if this is a long-term reaction, a long-term change, or a short-term one. On the other hand, and this can be said to, for many, might promote health if people have greater flexibility, managing caring responsibilities and not having to commute to work every day. But on the other hand, there's a view that if we get people back to work, meeting face-to-face, interacting as kind of social and human beings, then that will be better for their mental and emotional health. Do you have any comment on these kind of hybrid ways of working?
Sure. So many organizations, as you know, or maybe you don't know because maybe they did this secretly, the idea that working from home is going to give you more flexibility is not always true. first of all, you oftentimes work at home and you have not a private office or whatever. You're working, out of a closet or something under the difficult circumstances. But more than that, many organizations, and you just need to look under Google under the term I'm about to use, and you can see all the organizations that are selling this, downloaded software onto your home computer or to the computer you were using from home that tracked every keystroke, that filmed you using your camera, often without your knowledge or consent. And the idea that, and then of course there are artificial intelligence programs that permit your employer to analyze all of this. So the idea that suddenly, you're working from home and now you're free, you're not free, because there's all this workforce spying software, which, so COVID turned out to be very good for these software companies, not necessarily so good for the people who are being spied on. So the idea that just because I'm sitting now as I am at home, fortunately, I hope Stanford isn't spying on me, but if they were, I'm sure I wouldn't know about this. So working at home working at home actually turns out to be stressful. I mean, as a friend of mine said to me, she said, I am a mother, I'm a teacher, I am a nursery school runner, I'm a CEO all at once. Because I'm at home, my kids are at home, the school is shut down, I have to juggle all these responsibilities. And certainly in a high cost of living area like Sydney or like San Francisco, many people had roommates, and and if the roommates are all working at home, you have issues of privacy, you have issues of concentration, you have all kinds of issues. So the idea that working at home is some lovely thing is fine for me, because I live in a big house, and I have a private office. But for many people, it was not so nice. Holding aside the issues of social isolation, which of course are very real.
Thank you. And so as a final question, this one relates to the human resource management profession. And the person asks, in many businesses, HR often functions as a disciplinary arm of management, and consequently many interactions between HR and employees can actually add to stress. And the question then is, should there be a greater emphasis on HR being an intermediary between senior management and employers?
Well, HR, I think, there was an article in the Atlantic about HR and its response to charges of sexual harassment, which is mostly to get rid of the person who brought the charges. So HR, I think, has not done itself or actually its employers big favors by doing what the questioner actually alleges, which I think is very often the case. I mean, if HR was seriously interested in helping management build a more productive, a more efficient, and more profitable workplace and workforce, it would start by understanding the connections between behavioral and physical health, and the connections between health and turnover, absenteeism, productivity, and innovation, and all the other things that we've talked about, for which, by the way, you do not have to take my word at all. After all, I'm a Stanford professor, I should not be trusted. I mean, all you need to do is a search on Google, and you will see the enormous body of evidence that supports all the links that I have made. There's also the links, there's data provided in Dying for a Paycheck, there's data, so there's an enormous amount of evidence about this. So HR, I think, has, in many instances, misconstrued what it ought to be doing if it were serious about adding to the economic value of the enterprise. And the way to add to the economic value of the enterprise is, of course, to make your employees healthier. So if I said to you tomorrow, you are going to become the general manager or the head of HR for the basketball team, the Golden State Warriors, or you're going to become the head of HR for the Kansas City Chiefs, the only thing you would worry about is, in the first case, the health of Steph Curry, and in the second case, the health of Patrick Mahomes. And so you see in cases where a single individual makes an enormous difference, there is no rationing of healthcare. There is a lot of emphasis on hiring sports psychologists so that people enter the competitions in the right frame of mind. You hire chiropractors, you hire team doctors to keep your great athletes healthy. The analogy, of course, is exactly the same. Maybe there is no single person in your company that is as important to the outcome as Steph Curry is to the Golden State Warrior basketball team, or Patrick Mahomes is to the Kansas City Chiefs National Football League team. But in aggregate, your employees are in fact that important, that they produce the innovation, the products, and the customer service that make you successful or not. And if they are stressed, if they are depressed, the odds of them being able to be productive are very reduced, and their output is very reduced. And so therefore, if HR was to be a value adding rather than a value destroying function, it would take health and well-being seriously, not because of its woo-woo or whatever, or because it's an advocate for the employee, but because employee health is connected to performance in a variety of ways.
Look, I think that is an ideal way to end here in terms of the talk. And I really thank you very much for taking the time today. I think there's been clearly a lot of thought, knowledge, and wisdom that you've been able to share with us, highlighting what is clearly both a significant problem, but also for organizations, clearly an opportunity. So really, on behalf of the many UTS and Stanford Australia Foundation people that are here today, Jeffrey, a sincere thank you for a stimulating presentation.
Thank you. It was a pleasure seeing you. Maybe someday I'll get to come back to Australia and see you in person.
That would have been our preference. And so we'll keep that as an open invitation to you as soon as possible.
Thank you.
To all of those of you who've attended, whilst we do need to draw today's event to a close, we're very pleased to share the next UTS Business School Stanford Australia Foundation event, which will be happening early next year. On Thursday, the 17th of February 2022, we will host Jeffrey's Stanford colleague, Professor Sarah Sewell. Sarah is a professor of organizational behavior who's researched extensively on state and organizational level policy change and diffusion, and the role social movements have on these processes. You can head to the UTS Business School website for details, or stay tuned for invitations that will be coming to your email box soon. But for now, thanks again to our special guest, Jeffrey Pfeffer, for the tremendous insights, recommendations, and knowledge of in today's webinar. And to our audience, thank you for your time, and we look forward to hosting you again at UTS. As I said, ideally in person. On behalf of UTS Business School, goodbye.